What made me become a doctor is that, I do come from a long line of people in healthcare, and some uncles, my mom, they're nurses by nature and by training. My mom's always been someone I look up to, seeing the way she carried herself, her work ethic, the way she treated other people was really motivating for me. So ultimately, that's what drove me to pursue becoming a physician. Hi, my name is Richard Lopez. I'm an internal medicine physician here at Penn Medicine. I'm internal medicine trained, as well as I have a fellowship training in sports medicine. Concierge medicine actually stems from sports medicine. Historically, it kind of goes back to an NBA team doctor out west. He felt there was a need for more personalized care. Bringing you back to kind of the old school style of medicine, we want to introduce this concept of prioritization of that patient. It sets a precedent for how medicine should be done, and it's more forward thinking. Benefits to the patient include 24/7 access to the physician, to the medical team, to their health records. In addition, we try to reproduce an atmosphere that promotes wellness, that when you step in the building, you feel a sense of calm, you do not feel rushed, you feel like that day is dedicated to you. I see a variety of patients, typically ages 18 and above, although with my sports medicine training, I do have some comfort in teenage and adolescent care. The types of ailments that people present with can be your typical outpatient problems, your typical common cold or flu. It could be severe symptoms. It could be severe abdominal pain. It could be a recent heart attack or recent stroke. So it's managing those acute and chronic issues. I would say a lot of what we do is preventative. I think that's a big focus of, for example, our annual physical exam or a Medicare wellness exam. My patient relationships would certainly be long-term, and I think that's what I enjoy about medicine, establishing these relationships, not just getting to know their medication list or their problems, but getting to know that person, their family, their goals. These are the kind of important things in life. If a patient chooses me to be their provider, they can expect me to be their ultimate advocate, to be there for them in times of need, for minor issues, for major issues. Sometimes people just have a story to tell and they need a listening ear, and I'm happy to do that. I'm also happy to take the reins and help them move in the right direction. I want to make sure that I'm there for them and doing my best to fulfill their needs.